Right. Welcome, everyone. Can you see me? Yes? Okay. Um, I am Janet. I am the co-coordinator for Colorado, and I have the honor to introduce our next two speakers. We have Dr. Beth Dupree, who has had 35 years of breast cancer surgery in her background, and her focus really is mental health, bringing that to the forefront for all of us patients, which is amazing. And then we also get to hear from Miss Elizabeth Becker, um, who is a trauma therapist. And I'm going to let them get started. Dr. Beth Dupree is going to start off this session. Go ahead and type out any questions. Myself and another moderator who also speaks Spanish will be able to handle those questions and help the speakers. Welcome, everyone.
Thanks, Janet. It's really an honor to be here, and I have to say that I am thrilled to be sharing this hour with Elizabeth, because I think that this is divine intervention that we've been brought together for this meeting today. I am not a breast cancer survivor, but I am a breast cancer surgeon, and I've been doing this work for over 35 years. And what has been one of my main focuses, I've been working in every aspect of surgical care. I work with a lot of different companies, creating devices and technologies, helping to make this process better. And for the past 25 years, I've been asking every device company, would you make me a device that cuts out the fear when I cut out the cancer? And their answer is, wouldn't that be nice? Because what happens is we can physically remove breast cancer from your body, but the fear and the what I call the hangover effects of the cancer are significant. And they're even more significant for young survivors, because most women, when they're diagnosed under the age of 40, have no idea what hit them. And over the past 35 years of my career, I've gotten board certified in integrative medicine because I know the importance of lifestyle and exercise and stress management. And also in 2019, I got introduced to psychedelic therapy. I wasn't expecting it. It was kind of by accident. I've always been very, very focused on survivorship, because it's the time after the cancer and what you do with your life and how you embrace it that matters so much. And I was born in 1961, so I'm going to out myself with my age. And having been born in 1961, I watched all the advertisements where the two eggs were in the cast iron skillet of the frying pan and said, this is your brain on drugs. So I have always been very anti-drugs because of that. And it's just the way that I was brought up. My dad was a cop. Drugs were not an option. And what happened was, as I have progressed in my career, I've recognized how over-treated my patients were getting by their primary care doctors, well-meaning, of course. Someone gets diagnosed with cancer, you're allowed to be anxious, you're allowed to be depressed, and you're allowed to be angry. But when patients were coming back to my office with a pharma prescription for an anxiolytic, an antidepressant, a sleeping pill, I recognized that we're trying to mask symptoms and not actually get to the root cause of disease. So in 2019, having gone through a very stressful situation within a health system, I was feeling the effects of PTSD myself, and by sheer accident ran into a book called How to Change Your Mind by Michael Pollan. I was making up a talk on integrative nutrition, and I thought it was another book like Food Rules, an Omnivore's Dilemma about nutrition. And when I was listening to it, driving to the operating room, I'm like, wow, this dude's talking about LSD and psilocybin, and that was a very foreign concept for me. And what happened was, it sparked my interest to the point that I then read the book, pulled all of the data and the research out of Johns Hopkins and NYU, and really started diving into the unfortunate fact that the depression and the existential crisis that comes with breast cancer is not treated by the pharmacologic interventions that we have. It works about the same as a placebo. So that's what started me on this path forward. And I have subsequently become certified in psychedelic therapy through CIIS and synthesis and MAPS. and feel that this form of therapy, we are just on the crest of the wave where I'm not sitting here advocating for everyone to go out to begin, dropping acid, taking mushrooms, doing ayahuasca, doing things to utilize these entheogens, as we call them, or these, God molecules. I'm not advocating going out to use them recreationally. I'm here to talk to you about how therapeutic they can be in the appropriate set and setting. And one of my main goals in my next chapter of my career is to make sure that we bring these therapies to breast cancer survivors, not just at end of life, but after they've completed their traditional Western medical treatment, because we are not addressing those traumatic events that were part of your life even before cancer. And I'm going to use that as a beautiful segue to introduce Elizabeth, because she is a trauma therapist. She is a phenomenal human being. I've only had a few conversations with her, but I adore her already. So Elizabeth, I'm going to have you take it from here, and then we'll go back and forth.
Okay. All right. Well, thank you. It's so nice to share this platform with you, Dr. Dupree, and all of you. My story is I am also a 2-time breast cancer survivor. The first time I was diagnosed was in my 40s. I was diagnosed with ductal carcinoma in situ. It was stage 0. It was growing out of my nipple, and it was non-invasive. But as a result of that, they stayed on top of me, and I was diagnosed again for the second time, almost 10 years later. This time it was invasive. It was in my other breast, and I decided not to do standard of care. I was told standard of care would have been a lumpectomy, radiation, and probably chemotherapy. Because of a family history of breast cancer, I thought, I'm not doing any of that. And so I joke and I say that I got a divorce, and my ex got a girlfriend, and I got breast cancer. I knew it wasn't going to take my life, but I did know that it was going to change my life. I just didn't know in what way. And I ended up choosing to have bilateral mastectomies. And when I went into the OR, I knew that there was a chance that if it had metastasized or shown any evidence of metastasis, I would not be eligible. I would not be a candidate for reconstructive surgery. But I feel like I was very blessed, and it came out that all of my lymph nodes were negative, and so they were able to start the reconstructive process right then and there. And the backstory is how psychedelics came into my life was that I had, even though I'm a therapist, and you'd think I would know better, I found myself celebrating being cancer-free and without evidence of disease, and was rolled over. It didn't take long before I was completely flattened with survivor's guilt, and I hadn't done my work. So what Dr. Dupree is talking about is a very real thing. And so when people get diagnosed with any life-threatening illness, it does meet the criteria for what we would call post-traumatic response, potentially post-traumatic disorder. So when it moves from a response to a disorder is probably when most people could really benefit from getting additional support. And I did not do that. I walked around for a little while saying I'm cancer-free and I get perky new boobs. Until I showed up to go on a breast cancer walk and was completely rolled over with a sense of survivor's guilt, which sent me back into therapy. And I just happened to stumble across psychedelics with a girlfriend of mine who said, I'd like to introduce you to a group that I'm a part of. And the joke is that, like Dr. Dupree, I grew up during a time when we just said no to drugs, and I valued my brain. And so I spent my whole life just saying no to basically all drugs. And I was one of those people that didn't even really experiment much at all with very many drugs in my entire life. So when this girlfriend said, I have to tell you about this kind of group, it's a women's journey group. And I said, that sounds amazing. Where do you guys go? And she said, no, we trip. And I said, well, that sounds fun. What kind of trips do you take? And she said, no, we do things like ayahuasca and acid. And I just looked at her and I said, what? That's still a thing? She said, yeah, it's very much a thing. So I ended up going to this place here in Southern California, and I went to her group, and I met the most amazing women I'd ever met in my life. There was a physician, a veterinarian, a lawyer, like these amazingly smart women who were doing this work that I had never even really heard of before. And so I ended up having my own healing experience and my own healing journey, sitting in really a therapeutic environment, but it was also done in a more ritual, ceremonial kind of setting. And while it was very, very therapeutic for me and very, very supportive for me, I realized as I started learning more and more about psychedelics and the way that they could be used to help people heal a variety of different kinds of things, I also became aware of people who were were stepping into situations with practitioners or facilitators in ways that created more risk to them and was not very therapeutic in some cases. And so I decided, as a result of all of this and my own experiences, I decided to go back to school. Like Dr. Dupree, I went back to a graduate level training program, and I thought it was very important, if I was going to do the work, to know what it was I'm doing, how to do it effectively and responsibly. And so that's what I did. In 2021, I went back to school. There's a program called the Integrative Psychiatry Institute, and I completed my one-year training program through them. So like Dr. Dupree, I'm a certified psychedelic-assisted therapist. Having said that, somebody mute, yeah.
I'm coming outside. I'll be there in a minute.
I want to do it outside.
Bethany, I think Bethany
It's
needs
Bethany Morley needs to be muted, but I think you have
Mommy,
control.
when
over
did
it.
it say?
There you go. You got her.
Okay,
Yeah.
thank you. Thanks. Sounds like she's got some kids in the background.
Yeah, that's okay.
And that's okay. Of course, it's okay. But I think my own experience and my own process was a really, really important part of what I do. Having said all of that, I will say, and I want everybody here to know, that the only legal psychedelic currently in the United States is ketamine. And ketamine is in a dissociative class, which is it is a form of a psychedelic, but not all psychedelics are the same. So in other words, there are two that are currently in the process of being approved by the FDA. The first one is probably going to be MDMA. It's sitting on the desk of the FDA right now, awaiting breakthrough approval in the treatment of post-traumatic stress disorder. So that is really an important thing. And it's been the organization called MAPS, which is an acronym for Multidisciplinary Association of Psychedelic Studies. They're the group that has been pushing MDMA through this FDA process. So the other one that's I think going to be approved next, and it's already been decriminalized in lots of places around the country, including Colorado and part in places here in the United States, is psilocybin. So psilocybin is the active ingredient in magic mushrooms. And one of the people who's been really, really key in the research, Dr. Dupree mentioned folks at Johns Hopkins University, and the person who's really led the charge in looking at psilocybin and the treatment of people with cancer has been Roland Griffith. And oddly enough, unfortunately enough, he's been recently diagnosed with stage 4 cancer himself. So there is a list for people who are interested, and I think I don't know, to the host, I think you may have been sent a link for NIH, and the National Cancer Institute has got a list of places around the country that are doing clinical trials with psilocybin and cancer patients. So, but I think what I wanted, I want to turn it back over to Dr. Dupree. If there's anything more that you want to add to what I've said so far, or
Well, first of all, I agree with everything you've said. I just was with Roland Griffiths at the conference in Denver. It was amazing.
yeah,
I am
yeah, I was there as well. Yeah,
It was
yeah.
wonderful. I'm
Yeah.
cutting and pasting the trials that are currently available. And what's interesting is, most of these trials are created for late stage cancer patients. Bill Richards interviewed me for CIIS. He was one of my mentors, and his wife unfortunately died of breast cancer when his boys were 11 and 13.
Mm-hmm.
And one of the things that I have kind of promised Bill is that, on my to-do list is a clinical trial with psilocybin in early stage breast cancer patients, meaning stage 1 and 2 cancer patients after they've completed Western medical treatment, to be able to move forward with a clinical trial to follow outcomes, to look at, I know that, a diagnosis of cancer creates this heightened state of, it's sympathetic overdrive where your cortisol levels are high. And it's my belief, and it's something that I really want to prove, is that if we can take you out of fight or flight and bring you into a place where you are in peace with who you are inside, then the life that you live and the stress that you have is going to play a role on our bodies. So that's on my to-do list, and that's something that I've told Bill I really feel very, very strongly about. Currently, because ketamine is our only legal entheogen, we're going to be starting a program at my East Coast health system at Redeemer Health using ketamine for 2 things mostly. One is ketamine can affect the NDMA receptor. So patients who have chronic pain, you can use ketamine to decrease the dosage of morphine needed, so people can be more present during transition. And also ketamine is approved for refractory depression, which, because most depression or existential crisis that comes after a cancer diagnosis, it doesn't get affected by our typical SSRIs and prescription pharmacologic agents. So being able to bring those two aspects into cancer care right now, like Elizabeth said, we have to stay within those guidelines. Now, there are places where entheogens are legal, the Netherlands, Jamaica, several in Mexico. And so as states are adding, the decriminalization piece is kind of it's a wonky space, particularly for practitioners, because you can't provide the entheogen. And so what's happening, and what I've seen a lot, is people are going underground, which I'm not advocating. Some underground therapists have not been trained in the ways that Elizabeth and I have to do the appropriate screening, the intake, and the whole facilitation process, along with the integration. Because what happens is, during an experience with a psychedelic, a lot of things come up, and it's how you integrate and bring those stories and those pieces and those visions back into your day-to-day life. And so we're in a space right now where I think Oregon is first on the list. Colorado is probably next. A lot of cities have decriminalized nature, which is, ayahuasca, psilocybin, cannabis, a lot of, all of the naturally occurring entheogens. And actually, what's interesting is ketamine actually comes from a mushroom as well, which I recently saw that, and it kind of brought it all back into alignment. But in the meantime, I've done my psychedelic experiences out of the country, because part of this is, when you are in training to do this work, if you do not have these experiences, it's very hard to understand what somebody else is feeling. So that was part of the process. And I joke because when I applied to CIIS, I was what we call a psychedelic virgin. I had never tried any substance. And that was what was so interesting with my interview with Bill Richards, because I said, you know, the research that has been done was so compelling that me, the scientist, is willing, without ever having had an experience, to say, I know that we need to do this because what we're currently doing isn't making a big enough difference.
Right. Yeah. I yeah, I want to circle back to something that you said I think is really important, is that there are a lot of underground therapists, and you are correct. There are underground, I should say there's underground facilitators. Some of them are trained therapists. Some of them call themselves shaman, or they're trained in another tradition. So I think what I want to talk about a little bit is how, if people do want to look into whether or not a psychedelic experience might be beneficial for you, I think that there are some checklists, there are some things that you should know if you're exploring this. If you go out of the country, like Dr. Dupree said, I think it would be really important to ask questions of whatever organization or whatever group is hosting an event. It could be done in a recreational or ceremonial setting. I know amazing, highly responsible, highly skilled facilitators who are not therapists. The problem with that is when they don't understand the therapeutic process, and they don't understand the therapeutic relationship, and they don't understand trauma and the way trauma affects somebody's psyche, it makes it more difficult for them to do effective integration. So it's not a matter of one camp is better than the other. I think it's really about safety. Safety is of the utmost importance. So if you are going to explore some underground providers, I do have some recommendations and some tips on what you should be looking for in order to ensure your own safety. Because people worry about having a bad trip, and those of us who work with psychedelics say there is no such thing as a bad trip. There's only the trip that you need to take, and there's an unsafe trip. So if you're going to look and explore whether or not there are underground, responsible, safe providers in your area, and you want to have an experience, I think the first thing to do is ask about what their training and experience has been. Were they a therapist before? Because I was a therapist before with 30 plus years of training as a trauma therapist. So I did my original training up in Menlo Park at the National Center for PTSD. That in and of itself does not make me a great therapist. I think it's important to know somebody has solid therapeutic skills that have nothing to do with psychedelics. Are they just solid as a therapist to begin with? And like Dr. Dupree said, it always starts with a thorough intake and an assessment, because there are counterindications. Not everybody is a candidate for psychedelics. The reason why ketamine is the only approved psychedelic at the moment, like Dr. Dupree said, it is one of the safest substances, and it has the fewest drug interactions, which makes it incredibly safe. And so for safety purposes, that's why ketamine is being used right now. But other psychedelics, both MDMA and psilocybin, there are counterindications. So whoever is going to be working with you should be doing a thorough intake assessment. And it's a biopsychosocial that includes a real thorough examination or look at your medical history, current medications you're currently taking, and any treatment that you're currently in, especially if it involves any type of chemotherapy, radiation. All of that would be really important to let the facilitator or the provider know about. Lots of times people think that they're not going to be able to have an experience, so they withhold information. And that is actually the most dangerous thing you can do, is to not be forthcoming with any medication that you're taking, because there is such a thing called serotonin toxicity, which can be extremely dangerous. So you do have to tell a provider what it is you're taking. If somebody says, no, come on down, just jump into our ayahuasca ceremony, and they don't ask you any questions, I would turn and run.
Run.
Yeah. So there needs to be, they should be doing a symptom checklist. They should be not so focused on a diagnosis, but they should be focused on what your current level of functioning is, any medications you're currently taking, and any other resources. They should be assessing you to see if you are what we term well-resourced, meaning that you've been in therapy before. You know, all of your primary needs are being met. They're going to want to know about your trauma history prior to diagnosis of cancer or any struggles with treatment or cancer. They're going to want to know all those things. They should also do a prep session. They should not be saying, take your money and just come on in. A prep session includes some education. That should include some mindfulness training. They should be telling you what you need to do to physically prepare your body for the medicine. They should be able to tell you where their medicine comes from and how they assure that their medicine is safe. So they should have a safety protocol in place where they're able to tell you where their medicine comes from and how they make sure that their medicine is safe. Everything should be tested. You should never be asked to show up or bring your own medicine. The reason why that's never a good idea is because if you bring your own medicine, then the facilitator can't guarantee where it came from, or at the very least, they should test it and make sure that whatever you consume or take is completely safe. It's very, very difficult to adulterate a plant like psilocybin, but it is possible to adulterate something like MDMA. And right now, with the rates of fentanyl that's floating around and people are dying from, it's really, really important that if you go going to work with an underground provider, you know where their medicine comes from and that they're trained. That's why all these things are really important. So in addition to the prep session, there should be a really thorough prep session that should give you a chance to meet the person, to see what the environment is, because there is such a thing that's very important called set and setting. So the setting is the environment around you, you know, where you're going to be doing the work and having the experience. Is it comfortable? Is it safe? Do you have privacy? The setting or the set is the setting is you. So the person comes to the experience with their intentions, with their mindset, with their emotional coping skills, and everything about the individual is part of the process. And so that's, and you can get a trip sitter. There are programs out there that can help you find a trip sitter, but a trip sitter is not the same thing necessarily as a skilled therapist. So the other thing that happens is there's a prep session, there's a day of the journey. During that day of the journey, the person who is with you should be with you from beginning to end. If they leave the room at any point in time, it should just be for 60 seconds, 90 seconds to go use a bathroom. They should be with you the entire time. Their job and their responsibility is to ensure your safety and to help you process whatever experience you're having. So they are there to act as a scribe as well. They're writing down everything that's happening. They're writing down what medications you took, when you took them, whether or not they gave you a boost, how much they gave you. They are there to record, and I don't mean literally like record with a phone, although sometimes people do choose to record their own session. They're there primarily to make sure that you are safe and that whatever comes up for you in the experience can be effectively integrated. So the final thing that any responsible practitioner is going to include, whether they're above ground or below ground, underground, is that they're going to be able to provide you with integration. And basically what integration means is it's therapy. So it's important to know that it's the therapeutic process The medicine is just a tool. And there's a saying in the world of psychedelics is that you are the medicine. The medicine is just a tool. The medicine doesn't heal you, doesn't fix you, doesn't take things away. What it does is it gives you an opportunity to explore and to make new neural pathway connections in your brain that allow you to process the information in a new and unique and different way. So those integration sessions are the most important part, because without them, all the person did was help you get high, and you don't need somebody to do that. You can just go and get high by yourself. So what's really important about the experience is that there are those integration sessions, and there is a therapeutic process to support you as things continue to come up. Because it doesn't matter what the medicine is that you do, whether it's ayahuasca, psilocybin, or MDMA, there's a resonance to the experience. And those, you continue to get downloads and information days and weeks afterwards. And the therapeutic process allows you to be able to continue to make sense of that, not just in a way that's intellectual, but in a way that really helps you to make changes in your life moving forward. And it could be things like you make meaning of it in a way that brings great peace to yourself. I know for me, I will share with you my very first experience was with MDMA, and I was able to process a lot of what had happened to me, which was incredibly useful. My second experience was I was shot out of a cannon with ayahuasca. I would not suggest that as the place to start. That was my own experience, but I don't necessarily think it's the right experience for everybody. But what came out of that experience for me,
Elizabeth, can you just repeat that again? You said you were shot out of a cannon?
yes,
Figuratively.
literally. I mean,
I know, but what do you mean by that?
Figuratively.
Sorry, I
What
don't
I
get
mean
that.
is that ayahuasca, ayahuasca is it's tough. It's a serious medicine with a dramatic impact, and had it was overwhelming for me in the beginning, and I needed a lot of work afterwards for somebody to hold my hand and to support me and help me, because a lot came up. I would not recommend that. If people want to explore psychedelics, I did it in a ceremony, recreational setting with a very, very experienced person. So even though she was not a therapist like me, she has 30 years of experience journeying people. So I trusted her explicitly. And because of her experience, I knew I was in good hands. As a general rule, I would not suggest that people start with ayahuasca, because it's what's considered like the big guns, or the
mother of all
right.
entheogens.
Yes, she is referred to as grandmother. So she's very potent. It's very intense. There's a lot of purging. There's a lot there. It's a very intense. So yes, that's what I mean. Figuratively, I felt like I was shot out of a cannon.
For
It was
most
a lot.
people, that do ayahuasca, it's like you get called to do it. It's not something that you decide to do as a let
Whim.
me go hang out with my friends and have this it's not a recreational process whatsoever. It is a very, very intense. It was something that I personally needed after 35 years of surgery to learn how to surrender. But it's very important to do it in the appropriate set and setting. And I have a lot of very strong beliefs about when a group is too big. And I think 70 people is too big. 10 people was perfect.
Yes.
I will say there's one thing I really want to touch on with this is I've been doing retreats with breast cancer survivors since 2010. And from the beginning, we started out with things like journaling and vision boards and different types of healing modalities. And they were all amazing and wonderful. The breakthrough for me came in the spring of 2019 when we did breath work. And for a lot of individuals, breath work is a beautiful way to step into this world. So whether it's holotropic breath work or shamanic breath work or yogic breath work, your breath, you have the ability to enter into these states. And personally, when I did ayahuasca the first time, my biggest breakthrough came after, 2 days after the last session during breath work, when it all came very, very clear. And although I had the medicine of ayahuasca earlier that week, it has been my sessions with breath work, which I continue to do. My husband and I do yogic breath work in the mornings. It was that breath work experience, which I believe is a beautiful way for someone to step into this space. And I actually, during my training at CIIS, it was during COVID, and we were unable to do the holotropic breath work, which was part of Stan Grof's big, that was, it became a way to access this psychological space when these entheogens were made illegal back in the 70s. And so I get to go to San Francisco. I actually just booked my flight today to go to San Francisco to complete that training, which is, to me, it is a gift that I'm hoping that I'll be able to use breath work as a way to open up my Western medical colleagues who still have their blinders on and cannot see this, because it's safe, it's legal, it's effective, and it's a beautiful way to step into this space. A lot of ceremonial processes with whether psilocybin or ayahuasca or peyote, whatever, many of them also include some other form of breath work as part of it, because it's a very centering experience.
Yeah.
I don't want to step on anybody's toes. I'm just going to say we have about 6 minutes left per the session schedule. And there was somebody who did send in a question a little bit ago, and I want to make sure that that's heard. I don't know if you can see my screen, but I can ask it right now. It says, how important is a dieta for a psychedelic experience?
So a dieta is the preparation for the entheogen. And dieta could be a week long, or it could be like several days. And it's about, there's a spiritual centering, but there's also the physical, preparing your body, getting rid of caffeine, not eating meat. For ayahuasca, it's sugar, meat, caffeine,
Processed
alcohol,
foods.
processed foods, any medications that could potentially interact. And so every different entheogen has a different potential dieta. And that's something that if you're working with the right people, they're going to prepare you by, I just recently did a trip to Mexico for ayahuasca. And I do a 2-week dieta because I get rid of all alcohol, and I love caffeine. So getting rid of all of those things, all the processed foods, and it's really preparing your body to receive that plant medicine. And I think it's an incredibly important part of this process.
I think so too. And what I will say about the dieta is it is a lot of working with these plant medicines, or any of these medicines, is really about embodiment, physical embodiment, and mindfulness. So what it does is, by paying attention to your diet, what are you putting in your body, it starts to move you towards a process of embodiment. So you're paying attention to what you're putting in yourself. And while there's also a physical component of it. And so the reason for that is because these medicines work through your body. And if you haven't been focused on eating properly or taking care of yourself, then it can interfere with the medicine's uptake. It can also wreak havoc with your GI system and your stomach. So what the dieta is doing, it's doing two things. It's preparing you for the experience, and it's taking your mind and making you focus on embodiment, which is what the breath work does. So most good practitioners, whether they're running a ceremonial type of experience where they're facilitating that, or they're a therapeutic experience, both types of practitioners will ask you to start the process of embodiment. So embodiment includes things like diet, breath work, movement, yoga, sound bath, all the things where you can start to take. And I'll tell you why it's important as a cancer survivor, because I will tell you from firsthand experience, really, it's about reclaiming yourself. And when you can start to reclaim your body, that is where the healing starts. And it doesn't matter whether you're using breath work, yoga, psilocybin, MDMA. It's really about the process of reclamation. And that's kind of what I guess what my final words are around all of this is it's about taking control of your body. And you do that in part by giving yourself an opportunity to process what has happened to you with a little bit of a different mindset. And by moving to a non-ordinary state of consciousness or a shifted state of consciousness will give you the opportunity to process this information in a new and different way. So getting the support and having that be integrated is just really important. And it's made a huge difference for lots of people. And I've seen it both in my personal life, but I see it in the work that I do as well. So I do work with people who've been newly diagnosed with breast cancer.
The other thing about pre-journey is avoiding electronics, avoiding the news, movies, things that are very excitatory to your brain. You know, I've done now several different journeys, and getting myself into that space, the more meditation, the more breath work I've done, the greater the revelation through the process.
Yeah.
You know, my goal someday is to have a healing center here in Sedona where this is legal. The reason that I did training with Synthesis is because they were very focused on group experiences. And because the breast cancer community is already such a beautiful collective of energy and wanting to heal, I think it's really important. And that's probably going to be my next journey is going to be taking a group of women to Mexico where we can do this legally together, because I value my medical license and I actually want to be able to prove to the world that we can do this as a group. So thank you guys so much for your time and attention.
I am so grateful for the opportunity to host this session. It seems like there was a lot of good conversation, so much good information from both of our speakers. Somebody had mentioned if Elizabeth Becker could drop some of her information in the chat, just like Dr. Dupree did, that was super helpful for the participants. Thank you so much, everyone. We have 2 more minutes for any last minute words or questions.
May I share something? Yes.
Yes.
Hello, everybody. My name is Isabel. I am Mexican. I am a 2-time cancer survivor. And I just wanted to share a little bit about my experience. I can tell you that psychedelics just changed my life and my healing adventure. I experienced with psychedelics before I was diagnosed with cancer, with peyote, MDMA, mushrooms, LSD, everything. And when I was diagnosed, I stopped doing it because I was afraid because of medicine and chemotherapy, and I stopped. And once I felt I was strong enough to do it again, I felt this calling, like come back, because I wanted answers. I was searching for answers, especially why did I get sick was my main concern. Like what is happening with me? And so I got these mushrooms, and I did the session with my mother, and it was beautiful because it was a very loving session. We were alone in my house in a very safe place, and I also was experienced. It wasn't my first time doing psychedelics, so I was strong enough and secure. And I ask, like, when you are tripping, you connect with a source, a very loving and powerful source that gives you lots of information. And I got the answers that I didn't get from anywhere else. And this source, I asked, like, why did I get sick? And the source asked me back, like, are you doing what you love? I mean, are you doing what makes you the most happy in the world? And it was like, it changed the way that I thought, because actually I wasn't. I was like going to the office, and I stopped drawing, which I loved. And it was amazing because it opened my eyes and it changed everything. And I know I won't be sick again. I can tell you, I am sure, because I am doing what makes me happy now. So I just wanted to share this with everybody. And I really encourage for people to do it in a safe way, of course, but you should all do it.
Thank you
Thank
so
you.
much,
So
Isabel, for
beautiful.
sharing your story. That was really nice. And
Thank
to
you.
Dr. Dupree and Elizabeth, thank you so much for sharing your knowledge, your information. It seems like it was super helpful. Thank you for dropping the links and all the information. Anybody that needs their contact information, just go to the meeting chat and look there. Thank you so much. I really appreciate
Thank you.
both of you. Thank you for the
Pleasure.
opportunity.
Thank you,
Take
Dr.
care.
Dupree.